As an infectious disease practitioner, I saw many patients with infections that I couldn't give the best antibiotics to treat them with because of their penicillin allergy. And without an on-site allergist, I realized that this was a barrier to them getting the care that they needed. Because of that, I took it upon to start this program where we could really comprehensively assess patients with penicillin allergy and hopefully get them removed. Penicillin allergy is the most frequently listed drug allergy in a patient's record. The vast majority of these patients, however, are able to safely tolerate penicillins following an appropriate history and testing. Unfortunately, just by carrying that penicillin allergy label itself is associated with a number of adverse health consequences. These include risk of multi-drug resistant infections, increased healthcare utilization, increased healthcare expenditure, longer hospital stay, and even increased all-cause mortality. And so it's very important to get that allergy label off if we can. Unfortunately, there's a national shortfall of allergy specialists, and so access to penicillin allergy testing is limited for many patients. This is the case in my particular healthcare facility. And so my project was to try and build a penicillin allergy evaluation program for inpatients admitted. It began with the very beginning of fleshing out the details of what were the challenges we had in our facility with regards to penicillin allergy evaluation, what were the resources we had, and based on that specific context, how could we make an inpatient penicillin allergy evaluation program work? On the ground, this included having multidisciplinary meetings with nursing staff, pharmacists, infectious disease hospitalists, and systems redesign coordinators. And then the development of standard operating procedures and a screening process to identify patients who would be good candidates for penicillin allergy evaluation, all the way down to a core implementation team that would actually talk to the patient, take the history, and then perform a direct oral amoxicillin challenge, which is the test used to remove a penicillin allergy. In many instances, the removal of a penicillin allergy from a patient enabled them to get the best antibiotic therapy for their specific infectious disease condition and led to a shorter hospital stay and better outcome. And ultimately seeing that clinical success, along with the patient's own satisfaction of having that diagnosis of penicillin allergy corrected, was very satisfying to me. Long-term, my goal is to expand this program, not just for inpatients, but also for outpatients. Thinking beyond that, I realized that what we have developed and achieved is a very scalable and equitable way of removing penicillin allergy evaluation, and I would love to expand that across more facilities.